Okay, what we're going to do now is talk about the worldwide locations of the U.S. Army medical hospitals. You're going to see that the regions above the footprint of Army medicine is broken up into regions. We have the European region, the Pacific region, the North Atlantic region, Western region, Great Plains region, and the Southeast region. The red stars represents the location of the medical centers, and you could see that in Europe, that #1 red star is Landstuhl, Germany, where everyone who's wounded in Iraq or Afghanistan got medevac to Landstuhl before going to the United States. The next one is the number 39 there. That's Tripler Army Medical Center in Oahu, Hawaii, and they cover the Pacific region as far as providing oversight and medical coverage for all active duty service members. The North Atlantic region is number 13. That's Walter Reed, although now Walter Reed has been closed. And the assets of Walter Reed have been combined with Bethesda National Naval Medical Center. So Washington, D.C. still has their medical center, but it covers all of the North Atlantic region. The Western region is at Fort Lewis, Washington, and that is Madigan Army Medical Center, and that's in Tacoma. And they cover all of the western United States, and the Great Plains is at Fort Sam Houston, Texas, where Brooke Army Medical Center, now the Southeast San Antonio Military Medical Center, SAMC. And then there's the Southeast region, that number 23, which is Eisenhower Army Medical Center. All of the smaller dots represents the various MEDACs. MEDDAC stands for Medical Department Activity. That's going to be a test question, MEDAC. The MEDACs are various sizes from small, medium to large, and what determines the size of the MEDAC is the number of beds. So a small MEDAC may have 8 to 10 beds. A medium size could have anywhere from 10 to 20. A large MEDAC may have 20 plus. Smaller MEDACs have smaller staffing levels. Medium, larger staffing levels. So it's all proportional. And you can look at the map and you can pretty much see where all the different MEDACs are. The organization, we have the Secretary of Defense, the President's at the top, of course, Secretary of Defense, the Chief of Staff. Each branch of the service has a Chief of Staff. The Marines fall under the Coast Guard. The Marines have a Commandant, Marine Corps Commandant. And the Coast Guard used to be under the Department of Transportation, now falls under the Department of Homeland Security. Each branch of the service has its own Surgeon General, which is a doctor, and that Surgeon General is responsible for providing all medical services to every single enlisted NCO and officer in that branch of the service around the world. For the Army, we are broken up, as I mentioned, into regions. And each region is run by a medical command, and that medical command, or MedCom, is located at Fort Sam Houston, Texas. The medical centers each have MEDACs that fall under them, some more than others. And so the major regional medical centers provide oversight. So, for instance, for social work at Madigan Army Medical Center, the Chief of Social Work there is also known as the Regional Social Work Consultant. Each region has a consultant for each branch. There's a psychiatry consultant for Western region, psychology consultant, we have a regional social work consultant for the Western region. So if you're a social worker and work at one of the MedACs that is covered under the Western region, your immediate supervisor would be that social work regional manager, who is normally would be like a lieutenant colonel. And of course, you're going to have your chain of command in between, but he would be the one to answer and conduct any investigations, provide any help, support, assistance, etc., in your adjustment to your new assignment. Community hospitals are various sizes, as I mentioned earlier. Many are losing their emergency rooms, are converting to day clinics, and the staffing levels in each of these community hospitals will vary according to size. What's happening is there's just no longer any money to keep these things open 24 hours a day. And so the medical command is looking to save money wherever and whenever it can. So that's why in a lot of the smaller and medium-sized MedACs, they're closing down their evening services. Here is the Unified Medical Command. We have the President. The SECDEF stands for Secretary of Defense. And you can see how in order to consolidate medical services, each branch of the service would be coming together under a unified commander, which would be a 4-star general or a full admiral. And they would command all medical staffing, training, purchasing, operational readiness. Now, under that unified commander, we're going to have 3 3-star generals or vice admirals who are all doctors. One such doctor would be in charge of all the fixed facilities for the Army, Navy, and Air Force around the world. Another one would be in charge of education and training, research and development. And another one would be in charge of the Defense Health Agency. All this is looked at as a sort of a necessary first step in getting joint. And what I mean by combining services, Air Force, Army, Navy, so we're not duplicating our effort. Service delivery, clinical operations at home. Not all services are equal, and by that I mean that whatever you have at a small MedAC is going to be few and far between if you were as opposed to being at a large MedAC or a MedCent. At a small MedAC, you're probably going to have a psychiatrist and a social worker. You may not even have a psychologist. Medium size, you might have one of each. A large MedAC, you may even have a child psychiatrist assigned there. You're going to have MSWs, PhDs, and DSWs are doctors of social work. You're also going to have a number of GS civilians, to include GS medical doctors, PhDs, LCSWs. For those of you in counseling programs, it's brand new LPCs can now compete for GS jobs along with social workers. So that's something that you need to keep in mind. Social workers, you got to be on the ball. If you want these jobs, you got to stay sharp. You got to know your clinical stuff because LPCs are catching up and they're going to be competing for your jobs that used to be yours alone. The contractors and subcontractors, what you need to know here is the difference between both. A contractor is a large company that bids on a government contract to provide a service to the government. So the Choctaw Enterprises in Oklahoma, they have a contract for family advocacy. Their job is to provide civilian social workers to work in the family advocacy program around the world. That is what they're paid to do. What Choctaw then does, in order to meet the contract, they have to recruit LCSWs around the country to fill vacant positions where they need them around the world for the Army. That means you become a subcontractor. The subcontractor follows a statement of work, an SOW, statement of work, and that outlines exactly detail by detail of what your job description is, and you are not allowed to deviate from that statement of work. And then of course the final thing is TRICARE and Military OneSource. Where do social workers come from? Um, they come from long-term health education. There's an MSW program that if you have a bachelor's degree, the Army will pay for you to go get your MSW, and that's fully funded. If you are an LCSW with about 10 years of practice experience, you can attend the Child and Family Practice Program, which is fully funded. When I went to that program, I spent 2 years studying child psychiatry. So it was a great program, and it really expanded my clinical skill sets. You can also go get a PhD and attend the Child and Family Practice Fellowship. All this is incredibly demanding. And if you don't have a healthy marriage to start with, generally they don't survive the 3 years that you are in this program. Or you can just focus and get a fully funded PhD, where you can you have to apply to so many schools, but they have to be in your home state. So that is a great place to get the Army to pay for a PhD. They recruit civilian MSW schools where you get a direct commission and go on active duty. They recruit from subcontractors where you could be a subcontractor and find out that a GS11 or GS12 job is opening up. A subcontractor is going to jump on it because they want the benefits. And then, of course, there is the Army Fayetteville State MSW program for officers who have degrees and want to study social work. They train there, and in San Antonio is where that program is located. So at my vet center, I end up training the interns from that program. And that is it. That was the last slide. So we'll talk again soon.